All right, let's start this webinar. All right, hi everyone, welcome. Thank you all so much for logging in today on the Tuesday after Halloween. I hope you all had a good, fun, and safe Halloween weekend and a good spooky time. And yeah, hi everyone. My name is Nicole Elenoff, and I'm a senior manager on NASTAD's prevention team. And you all have logged in for our webinar, which is PrEP Coverage Check 2.0, a PrEP verification tool refresher. I'm joined by my amazing colleague, Ralph Moreno, who's one of NASTAD's PrEP access consultants, and I'll turn it over to him to briefly introduce himself.
Thank you, Nicole. Good morning if you're on the West Coast. Good afternoon for everybody on the Central and East Coast time. My name is Ralph Marino. I am a NASDAQ consultant supporting PrEP access and sustainability and finance-related inquiries. So I'm looking forward to driving this refresher in the end of the presentation after Nicole goes. So I will turn it over to Nicole, and I'm looking forward to presenting with everybody.
Thanks, Ralph. So this webinar is scheduled to last for an hour and will include some question and answer period. We are going to engage in some Q&A in the end, but if there's at any point you have a question throughout the webinar and conversation today, please feel free to put that question in the chat. I also want everyone to know that this meeting is being recorded and will be made available to you. So no fear, this will be made available to you all later on in the week. So to kick us off, I wanted to wish everyone a happy open enrollment. So today marks the first day of the open enrollment period, and open enrollment runs through January 15th, 2023. If folks enroll by December 15th, of this year, they will have coverage in time for the new year on January 1st. So if, let's say someone doesn't enroll during this open enrollment time and they have a special life circumstance where they get married or have a child, they are eligible for special enrollment. But right now, everyone is open for open enrollment. So happy open enrollment, everyone. So let's go over what we're going to be discussing today. So our overview of our webinar is just an overview of PrEP coverage being a right through the United States Preventive Service Task Force. We'll do an overview of that. We'll then do an overview about PrEP coverage check. We'll do a walkthrough of the tool, and then we'll have a Q&A. So Ralph will be doing our tool walkthrough for us today. But before all of that, wanted to review the drugs currently approved for PrEP. So we have tenofovir disoproxil fumarate and emtricitabine, or TDF-FTC, otherwise known brand name as Truvada by Gilead Sciences. But there are also many different generic, there's also many manufacturers of the generic formulation of PrEP, of TDF-FTC. So Truvada and many other generic manufacturers. There's also tenofovir alafenamide fumarate and emtricitabine, or otherwise known as TAF-FTC. Brand name for this is Descovy by Gilead Sciences. And this was approved back in 2019 and has limitations. It's only indicated for gay, bisexual men and other men who have sex with men, as well as transgender women. And the newest to our PrEP toolbox of options is cabotegravir extended release injectable suspension, or long-acting cabotegravir. Brand name is Apretude by Vive Healthcare, and this is our first injectable option for PrEP. Apretude is indicated for adults and adolescents weighing at least 77 pounds who are at risk for sexually acquiring HIV. So we have many different options for PrEP, which is very exciting, and helps lead into why this PrEP coverage check tool is so important. So let's talk about how PrEP is covered as a preventive service. So back in 2019, the United States Preventive Service Task Force granted a grade A recommendation for TDF and TDF-FTC as PrEP. So with this recommendation, the Affordable Care Act patient protections require Medicaid expansion programs and commercial health plans to cover PrEP without cost sharing. And this started back in the 2021 plan year. So essentially all health insurance plans must provide PrEP services without cost sharing. So PrEP medication, and I'm about to launch a poll question. What else under the USPSTF grade A recommendation, what PrEP services must be covered without cost sharing? So let's just jump right in to this poll. So under the USPSTF grade A recommendation, what PrEP services must be covered without cost sharing? So I'm seeing some folks saying PrEP medication, routine PrEP labs. Seeing a lot of people saying all of the above. Yeah, so we've had a lot of people post, and I'm looking at some of the conversation here in the chat. And yeah, thank you so much for providing some resources there, folks. All right, I'm gonna go ahead and end this poll. And yeah, so a majority of the folks are correct. So under the USPSTF grade A recommendation, PrEP medication, routine PrEP labs, clinical visits, adherence counseling, all must be covered without cost sharing. And by cost sharing, we mean a copay. All right, awesome. Thanks, y'all. So yeah, all plans must cover these services without cost sharing in addition to the PrEP medications. It's also important to note that these services must be covered at the intervals that are recommended by the CDC guidelines. So we remember that new guidelines came out in the end of 2021. And so the health plans, health insurance must be covering the frequency of these testing services per those CDC guidelines, the new ones of 2021. So that includes HIV testing, hepatitis B and C testing, creatinine testing, creatinine testing, pregnancy testings, STI testing, and adherence counseling. So let's say a health plan is not covering these services without cost sharing. Individuals can reach out to their state insurance commissioner to seek guidance on USPSTF implementation and PrEP coverage changes. So some considerations for preventive service coverage. And there's been a lot of questions as we've been implementing USPSTF. So I'm just going to go through some of these. So eligibility, the provider, not the health plan, should determine who is high risk for HIV and eligible for PrEP using CDC clinical guidelines. We know that with CDC clinical guidelines, anyone is eligible for PrEP. Services, the PrEP service, such as the office visit, lab, adherence counseling, must be covered without cost sharing, given that these services are integral to PrEP. But PrEP must be the primary purpose of the visit. With treatment, health plans are required to cover at least one approved PrEP drug as a preventive service. We know that we have many different drugs available now for PrEP that are approved by the FDA, but a health plan must cover at least one of them. Frequency must follow CDC PrEP guidelines. All providers must be in the network for the health plan. And as far as the health plans, all non-grandfathered commercial health plans must cover these PrEP services without cost sharing. So what are grandfathered plans? We've been hearing a lot from folks that they're not getting PrEP without a copay because their employer has a grandfathered plan. Grandfathered plans are plans that were in existence before March 23, 2010. And they are not required to provide all of the benefits and consumer protections that are required by the Affordable Care Act. For example, a grandfathered plan might not cover preventive health services, It might charge a higher premium based on health status or gender, and it might exclude coverage for pre-existing conditions. Unfortunately, there is not a list of grandfathered plans, but employers are required to share if their plan is grandfathered. So if, let's say, an employer purchased a plan prior to March 23, 2010, it might be a grandfathered plan. So I mentioned state insurance commissioners earlier. These are entities that individuals and organizations can reach out to seek guidance on implementation. This state insurance commissioners are definitely great resources to advocate to. They're a good tool here if a plan is not in compliance. So NASTAD is developing and will have a PrEP cost sharing complaint template released soon. It's currently in some final tweaks and will be sent out soon. And this is a tool that individuals can use to help when reporting and reaching out to a state insurance commissioner. So now let's go into PrEP coverage check and give a little overview. This is our second year of this tool. We launched it December 1st, 2021, and wanted to provide a quick review of this resource just in time for open enrollment. So this resource quickly verifies which PrEP medication is covered under a select health plan by utilizing the health plan ID. So earlier on, I mentioned that at least one PrEP medication will be covered without PrEP cost sharing. So instead of going through manually, individuals are able to use this tool to quickly verify which PrEP medication is covered under that health plan. The resource also allows individuals to search and compare marketplace plans. This is an update from the resource last year, where individuals before had to go on healthcare.gov and look up a plan and then come into prepcoveragecheck.org to look up if PrEP is covered. Now individuals able to do that all in one platform. However, this is only for marketplace plans. So if an individual lives in a state where they have a state-based exchange, they're not able to look up health plans or verify PrEP coverage utilizing this platform. But what if someone is in one of those states that have a state-based exchange? They can, on our prepcoveragecheck.org, they can look up their state healthcare exchange, and they could look at a video on how to find PrEP coverage and verify. And our website will take them directly to their state healthcare exchange. The resource helps link individuals to an enrollment assister. Let's say they need assistance getting a health plan for this year. This resource will help connect them to an assister. It has a login feature for quick access and being able to save searches. So being able to quickly go back to a previous search. And then it has the ability to report PrEP coverage gaps, which Ralph will walk us through as well. We are still going to be working on this tool. This is PrEP Coverage Check 2.0. There will be later versions of the tool with more special features and hopefully the ability to verify other preventive medications as well. So why this resource? Again, qualified health plans must cover at least one PrEP medication. So this resource quickly verifies which PrEP medication is covered, helping prevent clients from paying out of pocket. Ultimately, we don't want individuals to have to pay any money when they shouldn't have to at all, and don't want to create any more barriers for folks. This resource includes all forms of PrEP, including oral and injectable. So with the addition of Apretude for injectable PrEP, this tool will be able to look to see if cabotegravir is included in the pharmacy benefit. It assists navigators during open and special enrollment periods. Ta-da, this is the time. Creates advocacy opportunities. So if a plan is not covering any form of PrEP, this is an opportunity to reach out to the state insurance commissioner.
I was like, yes, so it's blind.
And if someone can mute their line. Awesome, thank you. So yeah, it creates advocacy opportunities. So if you see a health plan's not covering PrEP, you know, why are they not in compliance with this guidance? And then connects individuals to an enrollment assister to enroll in healthcare coverage, because it's more than just PrEP. Healthcare coverage can create so much more positive health outcomes. Resource limitations. I mentioned that this only works for healthcare.gov marketplace plans. There are 18 states that have their own state-based marketplace. They are listed here on the screen. The reason for this is because the way PrEP coverage check works is that we utilize API data from healthcare.gov to be able to populate the information in the health plans and verify medication coverage. Unfortunately, with state-based exchanges, that data is not widely available. And so we're not able to plug into these 18 states for their marketplace exchanges. However, we do have information on the site about the different state-based exchanges and videos on how to walk through verifying PrEP coverage. All right, so I'm going to give us a very quick snapshot of how to use this tool, and then I'm going to hand it over to Ralph to take us through the rest. So the first step, very easy, visit prepcoveragecheck.org. Then you'll click check PrEP coverage. You'll go in and search for a marketplace plan, and you would do this by looking up your entering your zip code, income amount, sex assigned at birth, your date of birth, age, and then you would check if you're a smoker, have Medicaid, or have insurance from an employer. After that, a whole bunch of health plans would pop up. You would select a plan. And then once you selected the plan, you would click the check button to review PrEP drug coverage. And then you will see if the PrEP drug is covered. And with that, I'm going to pass it over to Ralph so we can have some live demonstrations.
All right. And can everybody hear me okay? Nicole can just nod if you can hear me.
Yeah.
Okay, wonderful. So thank you so much, Nicole, for that amazing presentation. As she had mentioned, this is year 2 of what we hope to be a continuous stream of new iterations and new features that we could continue to deploy. In the very first year, we were very much deliberate or intentional about getting the tool live and getting the connectivity live and listening to what the users would really want in a new versions, features that would help them with their day-to-day. So we're going to have plenty of training. We have a user guide that's going to provide just basic functionality in general, how to work within the system. But I really want to use this time period to go through very much like a story, just very much use cases of where this tool would be very useful. And then once we demonstrate how we use it, open this up to a question and answer. I think a Q&A is a really good way to identify what new features can be put in. As opposed to last year, we will be iterating more features throughout the year as opposed to waiting until the next open enrollment. So with that, I'm going to go ahead and, Nicole, would you mind granting me access to share my screen really quick? Oh, there we go. That's all I needed. So we're going to share this one. Perfect. And first thing I want to note, if you were somebody that went to the website last year, you will notice that the website had a minor update with color scheme just to match or reflect NASDAD's updated style guide. So the website is very basic. On the front end, it tells you exactly what you can do. Search the marketplace, search for drugs, check for coverage. In the first version, it was very basic. It did give you the ability to search drug coverage, but you did have to go to the marketplace to get the plan ID. So the first thing that we've done as sort of a first enhancement is we do have the ability to search marketplace plans within. We know that this is sort of a, well, yeah, marketplace can do it as well. I really want to emphasize that with this tool, because we're very much focused on the preventative focus, because we're making this tool very community like, we want to basically let you know that with every search and with every function you're doing in here, the information that's going to disseminate back to us is going to help us interchange or intersect, get peers together when they need to, or interject is what I was going to say, when we need to in certain cases. So I'm going to go ahead and just first search my me personally. If you don't have the ability, or if you don't have a person at the point of care, so if somebody's not calling you and you're just wanting to look for plans, then you can bypass some of the other information. It will provide just a basic income. But if you do know the person that you're speaking with, you can go ahead and update the income amount, the age, the date of birth. So I'm just going to go ahead and put mine, the gender, the sex assigned at birth, and then some of the additional marketplace questions, like if you are a smoker, and if you're eligible for Medicaid or insurance through any other type. So I'm going to go ahead and hit search. If you don't click on the search button for the zip code, it will prompt it down here. So, but it does require identifying the county before it does the plan. So once I've searched, it's going to keep, the system itself is going to remember based on your user, the type of search that you've done. So if I've done a search for a 29-year-old with a 55,000 a year income versus a 44-year-old with a 30,000, we want to remember that because of the plan tax credits. So part of the premium tax credit subsidies. So once I search, I can go ahead and navigate through the different plans that come up. It gives me the plan name, the issuer, the plan type, and the plan ID. Now, at this point, it's giving me the cost or the premium based on the tax credit. And one of the things I want to, do with it now is I want to identify what specific PrEP medication is identified or is covered. So by hitting the check button, you'll notice that a pop-up comes up for cabotegravir, the generic Truvada, brand Truvada, and Descovy. I want to stop here and kind of define what you're looking at as far as the legend. So if you've got the red, no, or disable, that's a not covered. If you do have the exclamation mark, that's a sign that, or that's just letting you know that there is a generic covered. So whenever you see this, it's likely that there's always going to be the generic version covered in that. And then there will be certain plans that have a blue, I think it's like an information box. I'll find it in just a second. I think, let's see. Of course, there's not going to be one when I'm trying to find it. I will find one in a second, but that just tells you that there's no plan information. And that's important because if you do come across a plan that does not have the appropriate coverage, we do want to notify us, or we want to be notified so that we could keep track of it and make sure that that information is getting reflected. So you'll notice here, I've been siphoning through checked plans. I finally came across a plan that has coverage other than just generic. So what you can go ahead and do in that situation, and I'm doing all this not being logged in. So let me go ahead and stop really quickly and take a step back. One of the first things that you have to do with the new version, because we're keeping track of our saved coverages and we're keeping tabs on everything that we're, all of the queries that we're making, you do have to log in. So you may remember from the first version, you could come in and search a plan, which you can still do on this version. But if you want to be able to save, and I'll show you some of the enhanced functionality with saving and creating a profile. So that's going to be something you're going to want to do when you first come in. So quickly to do that, you're going to hit the user login button on the right. If you don't have an account already, you're going to hit the sign up, and then it's going to give you the first name, last name, email, password, and then selecting where you're from as far as the state. So I already have an account, so I'm going to go ahead and just log in really quickly. But the login's important because it does give us the ability, when you share something, it lets us know. So if there's a follow-up, if there's a request that requires any type of status change, we can notify you and whoever it wants to be notified for whatever the change is. So you'll notice the only difference between being logged in and logged out is now you can see my user profile. I do have some options now because I am logged in. So now I'm going to get back in. So same thing. I'll just search my zip code. And after you do this many times, you're going to get very quick with it. So I'm going to go ahead and search. And you'll notice there's one difference now that I'm logged in. And that's something that's why it caught my eye when I was searching. You'll notice now there's bookmark here, bookmarks. The bookmark designates that it's a plan that I've searched before and I've saved it. Now, for whatever reason that I've saved it, you have the ability to mark. So if you've saved it because there's a specific payer mix or payer group or client group that in the case that they call you or that they're coming into your health department, you want to navigate them to those types of plans. Or if it's just maybe your preferred plan for the doctors that you have contracted, but it gives you the ability to save it. And you'll notice, if I go ahead and check, I'm saving it because, this one for particularly had Descovy covered. But what that gives us now the ability to do, now that I've saved plans, is I can come into this history button. So now that I'm logged in, I can click on history. And the history tab, which is a significant enhancement from the previous version, gives us the ability now to look at two different things. So we can look at the plans themselves. Plans, if we want to open them up, we've got various sets of information specific to the drug. We're very open. We could put everything. We can put them in tabs, but this is the information that's going to be relevant for a navigator or an enrollment specialist. We've got deductibles. We've got the specific drug information, and then, as you know, we've got the coverages related to the PrEP medications. One of the things that it does give us the ability to do with this is now track the drugs themselves. So instead of searching and querying different plans, seeing which ones are covered, you now can toggle behind the toggle to the drugs themselves. And within each of the drugs, you now can see all the plans that you've searched, when you searched, and what the coverage is. So if a plan is expired or I don't want to cover it anymore, I can simply just move it into the archive. Archives just keep track of our old information, old searches, but keeps it out of view, so you're not having to siphon in and filter through it. One of the other things that we've done with this is the ability to do coverage gaps. So as Nicole had mentioned, when you're searching, if you're a navigator or you're searching plans for your clients, or a client calls you because they were just denied at the point of care, or they got an invoice or a bill after the fact for a copay or not copay, but for some sort of deductible amount, but they're not supposed to, then we have the ability to identify what we call coverage gaps. So coverage gaps work very similarly to like a task manager, where you could identify the drug that wasn't covered, the plan that it wasn't covered under, and then the reason why. And I'll walk you through how easy it is to submit these, but I think the relevance behind submitting coverage gaps when you identify them is you could have a coverage submitted that we've got somebody else that just submitted, and taking those two inquiries, now it gives us more leverage or more information to be able to populate in the drug or the commissioner, insurance commissioner complaint template that we're putting together. So there's a lot of value in the community providing us information, because as you know, we're not everywhere, and we can't rely on the information that some of these connections are giving us. The APIs, because as you know, a lot of the it can happen where insurance companies are giving misinformation that's not quite accurate, that's on the marketplace. So to go ahead and do a coverage gap submission, if we go back to the home page, you'll notice that in addition to the check PrEP coverage button, we have a report coverage gap. Now, if you know the plan, like if it's a Blue Cross or a United, then you can go ahead and search it here. If you know the plan ID, which if you're working within it, you'll note you're going to have the plan ID pretty much everywhere as we move through it, because it's just an easy identifier to get specifically to the plan that we're looking for. But if we don't, if you know just the general, then you can select, let's say it's a United Healthcare plan. So now you've got the plans. Now these are going to be specific to your state. Remember, because I'm in Arizona and I'm looking at my zip code where I'm coming from, it's going to provide me with the plans that are covered in my area. So let's just say that maybe this UHC bronze value plan had an issue with it that I need to report. So what I'm going to do is hit next. Now we've got 4 coverage notes that we've sort of defaulted to, but we are opening it up for any additional issue that you might face. So the top 4 most high frequency coverage type rejections are, well, the billing rejected. The drug wasn't covered for a particular reason. Billing rejection could also report to a medical or a lab. You also have labs not covered. And then we have long-acting injectable coverage. So these are just specific report coverages, but we also have the ability to provide any different type of note. So I could go ahead and say that this was if it was a drug coverage issue, it does give us the ability to select which drug it was. So let's say it was Descovy. And now I can just say, you know, plan mismatch. Now, what that's going to do when I submit the request is, it's going to provide this here. So now I have the ability to keep track of it, but it's also sending an email to the PrEP coverage team on NASTAD. So as you submit, while you're tracking, you might come to a conclusion on your own because you got to the right person. That information that gets back to us helps us then disseminate it to everybody. So if somebody that is also working in your state that might be interacting with those plans, they come into PrEP coverage check, and now they've got a banner saying, by the way, if you're getting a rejection on a specific plan, use modifier code or use specific billing codes in this specific order. It's giving us the ability to use our community as an information gathering and dissemination source. In addition, the last few things I want to touch on before I open it up to a question and answer, and even maybe a strategic session on what can make this system better. I want to just touch on 2 of the other things that Nicole had mentioned. So for the states that aren't available on the marketplace, we do have the ability to come to this part of the website, which is the state exchange, which at that point, you have the ability to open it up and view the specific videos. The videos were put together by us, so please mind the poor production quality, but it is very useful in identifying if you were going to go to your own state specific website, how you would go about doing what we're doing on this site. Now, I will preface that you won't have the ability to compare. Well, you have the comparison tool, but you don't have the ability to compare side by side, which I just reminded myself on something that I wanted to touch on over there. But it also doesn't give you the ability to interact with NASTAD team on the fly. It doesn't give you the ability to notify a drug coverage error where NASTAD can follow up on the fly. One of the things that we are in discussions for the next version rollout is, for each of these states that aren't on the marketplace, we would love the opportunity to cover it or to identify a specific state that's willing to share or open up their marketplace with us. Because if we can open up their API or their data feeds, maybe even public use files, then this system itself can be more comprehensive and cover more states, maybe not all, but at least the majority. One of the things I wanted to come back to on the history of the plans that we're searching is the comparison tool. So remember, I had showed you, you have the ability to open up and look at plan documents, or sorry, plan information. Nope, we're going to go out. But we also have a comparison. So by selecting the comparison, you can compare up to 3 plans. Not that if you try to do 4, it might break it. That's all I'm saying. But 3 plans works very nicely. to basically identify the highlights of the plan. We're very open to what some of the team members around the country are identifying as highlights for their plan, because we're more than happy to build custom highlights that could be toggled based on what you're looking for. But we've got premium, deductibles, out-of-pocket max, plan medals, and the drug coverages. But this gives us the ability, as the plans that you're searching and bookmarking start to build up, it gives you an ability to assess maybe 2 plans if you're on the fence about them, or if you're interested or concerned with what the potentiality could look like as far as coverage and potential out-of-pockets. There is an enrollment assistance that we're looking to build out more comprehensively, just as a simple way to connect individuals and connect health departments with resources that don't have their own versions, or maybe they have contracted versions of navigation and coordination support. As more users log in, this enrollment assistance will grow. And then we do have a support at, like any system. We just want to make sure that if you have questions about it, or if you have technical assistance that might come about with it, because we want the tool to work best for you, but we also want the tool to grow with the evolution of the roles and responsibilities of our team members. Some of the version functions that we're looking to roll out as far as next version, we've already been testing the ability to search all drugs. So as you know, right now, we just have, my voice is starting to go out. We have our own, we just have the PrEP medications, but we've been testing and now have the ability to search any drug on the fly, add them to the list, and then compare and contrast. So that's going to be a very significant added value when we're looking at some of the drugs that are on top of our PrEP regime. We'll be adding the ability to add provider coverage. So adding doctors in addition to the PrEP, and then be able to compare them similarly. And then lastly, looking at having a sort of a central activity forum where not only we can report on the updates to commissioner updates with the insurance, but something that we've been wanting to do for a long time, and that's update or provide an ecosystem to update PrEP pricing. Financing and sustainability are something that is kind of at my core, so that's something I'm very excited to roll out. But other than that, we really want this, to grow with, the functions and the use that our day-to-day public health workers are experiencing. So this is by no means, static. We think the feedback is really going to help. Additionally, you're going to have the video training. You're going to have a user guide that's available on our NASTAD website that you'll be able to go to, and we'll be adding new functions and workflows ongoing. But we're really excited to release this new version. So as soon as I get off this call, I'll be pushing it to production. You'll see the color scheme change and everything, and you'll know you're in the new version. If you haven't created an account already, you'll have to create a profile for the first time. But if you did create a profile in the first iteration, your profile will still be intact. If you signed up and can't remember the password because it's been such a long time, a simple forget your password will get you back up and running. But I really appreciate everyone jumping on and taking time out of their day to learn about our new tool. And we hope that you're going to get a lot of valuable use out of it.
Thanks, Ralph. I wanted to open it up and see if anyone had a question or, well, wait, can you put that back up?
Yeah, I was scared. I didn't think I was sharing at one point. I'm like,
no, you were sharing the whole time. It looked great.
Cool.
I was wondering if anyone would like to share a zip code for us to walk through
Sure.
together. Someone wants to share a zip code in the chat. All right. Tahira added first. So 19107.
Oh, I hope this is a state that's actually Philadelphia County. So let's go low. Let's go 29,000. That's on the cusp.
So I know that Pennsylvania has a state-based exchange. So this is a good example of what would happen. And so, yeah, we see that it's not able to come up because it's part of the state-based exchange.
That's true.
Yeah. All right.
So we have a state that's on the marketplace. Now, you're going to get that if you're in. What we're going to add to that, though, is we're going to have it auto navigate to the actual state-based exchange. So I'm glad we got to walk through that, because we know that we are going to be working diligently to provide actual access for some of the states that are aren't on it. So I think that's very important.
All right. We've got 61822.
All right. So Champaign County, Illinois. So, and we know now it's now on, and now we've got our list of, so we've got our Health Alliance, Blue Cross of Illinois. And let's go ahead and look. So we've got all three covered. 3. And we've got no Truvada here. I was getting a little nervous seeing the same call every single time. But yeah, so it looks like Health Alliance is covering predominantly Truvada and Descovy. And then you've got certain issues where Blue Cross is only covering Descovy. So if I wanted to, I can come here and essentially save. And you'll notice as you save, the only difference between saving and not saving is, it's not going to give you the ability, and it's going to be bookmarked. And then if I want to archive it later, I have that ability. So awesome. So I guess a question that I have for the group, and nobody has to jump up all at once to answer, but how frequently do you find yourself going to the marketplace, or is it mostly the clients going to the marketplace first and then coming to you for assistance? Or do you see yourself sort of a healthy mix of having to query on behalf of the patients while them doing their own? So if you want to just provide a quick update on the chat, that'd be super helpful. It's just kind of getting a lay of how that works. Awesome. So the first thing I see, and this is actually a really good use. So the first thing I see is most folks we see already enrolled. So a lot of times what we're going to be doing with this is doing a plan verification and wanting to see what the plan details are, right? So if they're calling us, they say, hi, I'm part of a Blue Cross. They may not know what the plan ID is. So you're going to have to then say, do a little deductive reasoning to be like, okay, is it a Blue Cross versus United or Health Alliance? So that's a very, I imagine that's probably predominantly. Levi said insurance is scary for most people. I couldn't agree more. I myself just trying to start companies and do things and be freelance, just jumping back and forth between employer sponsored insurance and marketplace, and knowing when you have a life-changing event versus what's covered. There's just a lot of ambiguity. But I think, with some of the cost sharing benefits, I think it's important to educate and let clients know that maybe even 5 years ago are sort of misconceived, and sort of let them know that there's these new regulations that allow for us to make it less scary, essentially. So who would know what PrEP med is covered? So that's a very good point, Nicole. I learned this the hard way when we were first building this tool out, in terms of just the fact that I was a pharmacy technician by training when I started my career, and it's been a while since I've done it, but that the drug strength can change dramatically, whether it's actually used for PrEP or not. So you run into this issue if somebody may know the root of the word, or may know what the generic is, but as they start typing it into the marketplace, it may come up with the wrong version. So they may be selecting a plan or based on drugs that they think they're taking that are potentially the wrong dosage, the wrong strength, not dosage, but the wrong strength, or just the wrong version that they need to. So it's important, again, to provide that education, that we're a resource, and that could help mitigate some of that. So we've got, oh, go ahead.
I was just going to ask if other folks had questions about PrEP coverage check or ways to use it, or I see Madison put a do you have any tips for helping patients with pre-authorization for Apretude? Also, do any insurances currently cover Apretude that you are aware of? Great questions, Madison. So I know that ViiV has some resources to help with prior authorization. NASTAD also has a resource on long-acting injectables. I'm going to put the link in the chat. So as far as health plan coverage, so some health plans are covering long-acting injectable PrEP as a pharmacy benefit. Some are covering it as a medical benefit. So again, like going through a health plan is really helpful because a lot of health plans will cover it if there's prior authorization for long-acting injectable PrEP. The prior authorization process, from my understanding, has been a little tricky because some health plans are requiring providers to say that they are like the patient is physically unable to do oral PrEP. And so it can get a little tricky, but I know that ViiV offers some resources on prior authorization, and health plans are covering it if there's prior authorization, but also let's say there's an individual has kidney disease and long-acting injectable PrEP is the only option for them, then there will be coverage.
And what's Madison, what state are you, by the way? If you want to just drop it in the chat, that'd be super helpful. Maryland. Okay. I think would be interesting with some of them, and we're sort of investigating this state by state, and you could be a good use case, but we're looking at sort of using the marketplace, some of the new functions to assess statewide all the plans that are currently being offered, so that we could sort of have sort of a directory off the top of which ones preliminarily are saying that they cover Apretude, and then if they don't, sort of setting up a plan for how to get it prior auth. So that's something that we could, I can reach out offline and maybe see about if just what Maryland looks like, what's your current process. But I think the more that we could be proactive in looking at coverage instead of waiting on the clients to come to us, it'll make us more informed in where we navigate them at the point of, the point of care. So.
Thanks,
Sweet.
Ralph. We've had some more questions in the chat. So Christina asked if we're working on getting some states with state exchange marketplaces onboarded to PrEP coverage check. So the reason why we aren't with states right now is because of the data. And so NASTAD, we're working on figuring out ways that we can access state marketplace data so that it can eventually be utilized for PrEP coverage check. I see Elias had a question about PrEP coverage and the Texas ruling. So I know that there's a lot of eyes right now watching what's going to be happening, because I know that it's not just PrEP right now, it's all USPSTF preventive. So all USPSTF preventive service coverage items are being watched right now, and NASTAD in our policy wing has been doing a lot of advocacy around all of this. So stay tuned, more to come. What other questions do folks have?
Before somebody jumps in, and maybe you can put this in the chat as well, has anybody had any particular successes in their communications with insurance commissioners, or do you just have a good are there any states that have better relationships that you feel, or is it pretty much across the board that it's just kind of hit or miss with getting, responsiveness. There is a resource by Nicole, and that question may be difficult. So if you don't know, I think, some individuals may have, more interactions daily with insurance coverages. But I am very interested, because as we grow this tool out, we do want to make it a place to really use our resources to interject proactively when we can. So the more that we can identify these ways and be more, not be so reactive, I think it's going to help us out in the long run. So.
Yeah, any feedback that you all have on ways that we can strengthen this tool, or ways that we can further assist you all with different resources, please let us know. I put a link in the chat from the Kaiser Family Foundation about some of the preventive services requirements and challenging those requirements. So there's a brief in there just talking about that. Yeah, so I had another thought. No trainings are on PrEP and 340B. Please stay tuned. We are going to be releasing some of the first modules of the TelePrep online learning series, where there's a whole module on PrEP and 340B. So please stay tuned. More on that to come. Really looking forward to all of the different PrEP things coming up. Again, we put the user guide in the chat, and we'll be sending that out when we send out this recording. But if you have any questions about PrEP coverage check, definitely reach out to myself or Ralph, or you could reach out to prep@nastad.org. And that's a great email in case you have any PrEP questions. And then that template that can be used for the insurance commissioners, the PrEP cost sharing complaint template, will be available very, very soon. Any other questions or any other things, Ralph, before we sign off?
No, I always say no, and then I lead in with something, which is kind of like an oxymoron. But no, thank you so much. But I just want to add that I'm really looking forward to your signups, your registrations, and then the feedback. So please, I want to make this very interactive. So I don't want you to think that by creating an account and going in that you're going to, automatically be thrown into the ether. So if you have any questions about any parts of it, or questions about specific just subject matter, please reach out, because I think the tool could grow from that sort of feedback as well. So with that, that's all I have, Nicole.
Awesome. Well, thank you all so much again for joining us today, and happy open enrollment. Let's get folks on PrEP. Have a good rest of your day. And thanks so much.
Wonderful. Thank you so much. Have a great day.